Hi, Artur, again. Thank you so much for joining us for a second time to answer more of the questions from the long COVID community, who are incredibly grateful again for your time. I will jump straight in because I know that it's a really busy day for you. One of the questions, and this is something that I'm wondering as well, if we could touch on mast cell activation syndrome and the relationship between that, or the potential relationship between that and dysautonomia, PoTS, post-COVID tachycardia. It seems like there's a lot of people who are finding some relief with taking antihistamines and reducing their symptoms that way. Is there a connection, and how should we manage that, if there is?
So first, thank you again for inviting me to this discussion. And let's jump into this question. Mast cell activation syndrome is a lot of discussions going on different places on the internet and among patients, among doctors as well. What role mast cell activation may play in the whole scenario of PoTS. We know very well that there is an overlap between PoTS and mast cell activation problems. The proportion of this overlap is not well explored. Recently, we have performed a study on a sample of patients from 2 different American locations. What we found was that the substantial proportion of patients with PoTS were positive, both for typical mast cell activation symptoms. Wow. And for 4 different laboratory tests. The problem is that these tests are not very well available, and the interpretation of this test is difficult. So some doctors, probably in their frustration, dealing with so diffuse symptoms that are difficult to treat, and patients as well, they try different antihistaminic drugs using a methodology which we call ex-uvantibus, meaning that we treat and see what happens. If something good happens, then we know we hit the right target.
Yes. So
that's why some doctors, based on patient symptoms, just like skin rash or headache or suddenly upcoming palpitations or problem with gastrointestinal tract, diarrhea, they guess it might be mast cell activation problem. So they treat the problem with mast cell stabilizing drugs and antihistaminic drugs, blocking the receptors that histamine attacks in the body.
Yeah.
And if there is relief, then there is an indirect proof that this could be mast cell activation problem.
Okay, so it's worth then people with long COVID perhaps approaching their GPs and asking for a trial, see if it's okay, suitable for them to take some antihistamines, or to perhaps, I mean, is there any value in eating a low histamine diet as well? Is that something that could help for a while?
I think
trial.
I'm not an expert in diet recommendations, but as I have heard, this low histamine diet may help people with mast cell activation problems. And some of patients, they report that they feel much better following the diet recommendations for low histamine diet. So patients see the difference. Doctors see the difference, so it must be something good in following this diet recommendation. If it works, so we accept it as, again, ex-uvantibus method, meaning that if you treat the problem by guessing what it is and the effect is good, then we accept it as a correct way to go. Just coming back to the first part of your question, this is very important to understand that antihistaminic drugs are not very problematic for the patient to take. The side effects are not very dangerous, and you will get the response, whether it works or not, very quickly. Yeah. So you may decide, this is good, it helps me within a period of 2-3 weeks. So it is worth trying.
Okay, brilliant. And then I've done a little bit of research on that, and I know that a combination of H1 and H2 blockers would work in the best way for this. So we're talking about kind of, your antihistamines that everybody's familiar with, the Benadryl, the Claritin and Loratadine and all of those things. And then also the H2 blockers, which are famotidine and related drugs that help with usually stomach acid suppression. Is that correct?
Yes, that's correct. We call it a complete blockade of histamine receptors. There are two major types, H1, H2. H1 are more expressed in the cardiovascular system, in respiratory system, whereas H2 are more expressed in the gastrointestinal tract. So if your symptoms are very diffuse, coming from different areas in the body, then treating both receptors probably will give you more relief than just treating H1 receptor.
Yeah.
H1 receptor is probably more effective for asthmatic problems, palpitation problem.
Brilliant, thank you. That's really, really helpful, actually. So I wanted to talk to you along the lines of vagus nerve stimulation as well, or vagus training. There's lots of people that are doing Wim Hof. I don't know if you've heard of Wim Hof. He's a Dutchman who does cold water immersion and breathing techniques to help strengthen his immune system and his health generally. There's a lot of people who are asking if it is dangerous to do cold water immersion, so putting yourself in icy water temperatures. Is that dangerous at this point because of potential heart problems, or is that something that we can go ahead and try to get our vagus nerve working properly again?
And so frankly, I've never heard about this method, and I've never tried this out by myself.
You need to Google now.
What actually we use this in another context. We had a methodology of testing the constrictive power of vessels, peripheral vessels, or autonomic control of peripheral vessels in a way that we used to merge one hand on one side in a cold water, and we measured how the vessels in the other hand respond. There is a loop, neural loop, that control the vascular tone, so vessel caliber. So if you merge your hand in a cold water, that the other side should respond. The brain gives you the signals to the vessels, sending signals to the vessels to making them contract. So if it doesn't work, there is dysautonomic problem or dysautonomia in your whole cardiovascular system. Wow. So it works, of course, but it doesn't work so well in dysautonomic patients with PoTS, with orthostatic hypotension, with other dysautonomic problems. It's this loop, this neural loop controlling the vascular tone doesn't work so well. So I wonder, we're talking about the same sort of patients who already have these problems with neural network not working properly. So if it helps through training, probably maybe you can learn, you can teach your brain, your body can learn, or you can teach your brain to respond in an appropriate way by repeating the same provocation test. So it may work. I'm not aware of such studies, but it may work.
So the cold water shock, so if we were to go and sit in a bath of cold water or have a very cold shower, that's okay to do?
Oh, this is what people do in Finland.
Dangerous for our hearts at this stage of the game.
Jumping into the cold water, and some of them they remain very healthy throughout their life. So this stress factor, as long as you don't have pacemaker or some other devices, electronic devices, so or you are very sensitive to weather change, so probably it should work and should keep you in good shape if you do it regularly.
Okay, that's brilliant. Thank you. And then there's lots of other things, sort of along the lines of breathing exercises and meditation and things like singing even, which are supposed to help with the vagus nerve. And I'm just wondering how much of a role your vagus nerve plays in patients with PoTS and dysautonomia, and whether doing those things to help your vagus nerve to recover or to function better is a helpful thing to do?
This is a very interesting issue, a very interesting question that you just posed. And we may say that vagus nerve is a sort of a relaxing nerve. It makes you relax. It takes part in the process in the body of process of relaxation. So the sympathetic system makes you run and fight. The vagus nerve makes you relax and take care of your food that you just have eaten. So it's the nerve that calms down your body.
Yes.
So if you feel just like running a marathon, having PoTS, if you stimulate vagus in a more or less artificial way, or using some more natural ways, just like meditation, relaxation, maybe cognitive behavioral therapy, and so on, probably through some brain connections, you may impact the vagus nerve and the whole parasympathetic system to make your body relax, getting quiet, being more calm. So it may work, of course, but it must be being aware of the chronic character of PoTS. You should be aware that this methodology or all these measures should be applied in a regular way to work. Not just that you whimsically perform one meditation per month. It will not help you very much, but probably if you perform it every day, it will have some effect on your body, even if the underlying pathological process is there.
Yeah.
Just like you put, even if your leg is amputated, so you can put a prosthesis on it, and you can use your leg, the rest of your leg. So it doesn't mean that your leg just became intact again, but you use a method to compensate for the loss of the part of your body. This is the same with PoTS. Some part of your body doesn't work properly, but adding different methods, you can compensate for the damage that is caused by the disease.
Brilliant, thank you. Yes, that's good. So I'm doing well by meditating. That's good to hear. Okay, so is the excessive fatigue that we are suffering, I think we might have touched on this last time actually and pretty much answered this question, but the fatigue is due to the dysautonomia, or is there something else that's making long COVID patients very fatigued all the time?
Oh, this is a very puzzling issue again, and frankly, we are not sure whether this is a central problem, the problem that comes from your central nervous system. Is it a problem which is situated in your brain? This is in your mind, in your brain, or is it just a response to your body working very inefficiently during this overstimulation caused by sympathetic system? Maybe both of these processes are there. Maybe your central nervous system is affected and the rest of your body is affected as well. We don't really know, but even if you rest for some time, this will not make you feel much better. So this fatigue is there even if you rest. So it would point at central problems as well, central nervous system problem as well.
Okay. And we're seeing, starting to see people saying that they have recovered or are 95% better from long COVID at around kind of 18 months. And these people are saying that all they did was rest, and nothing else. So do you think that, is there value in just kind of allowing your body to recover, just doing nothing and just resting?
Yeah, we can put it another way. So just we discussed vagal stimulation, which is an artificial relaxation in the body. So if you let your body rest and get more forces to counteract the pathological process which is going on in the background in your body. So if your own curing forces are strong enough to stop the process, if your body gets sufficiently smart to get rid of the problem, to reset the immune system, the inflammation, which probably is there in the background, then you may recover by yourself. But if you cross the limit of your compensatory mechanism, or your own compensatory mechanism, then the disease will go on.
Okay.
This is how we see it today.
Yes. Okay.
So you have your own forces that can make you healthy again.
Yes, and those are working while you're in the parasympathetic mode, aren't they? Because that's when healing takes place, when you're in that parasympathetic state rather than in your fight or flight that we all get stuck in all the time. So it does make sense that just resting, I guess, puts you into parasympathetic and healing mode. Yeah. Okay.
That's why some PoTS patients feel very much nausea. Nausea is a signal from the vagus, from the parasympathetic system. Just don't do anything. Just keep quiet and rest for a while. So don't do anything. Otherwise, you get this nausea. It may have other consequences as well. So this is a signal from your central nervous system. Just keep quiet now.
Okay. We should listen to our bodies then much more, I think. So the interesting question here actually from somebody who has already complex PTSD. And they are asking whether COVID or long COVID, sorry, is there a relationship between patients who are perhaps already struggling with trauma, with PTSD? And I guess this is another link to that sympathetic nervous system, isn't it? In that people who have PTSD are often stuck in that sympathetic nervous system zone of fight, flight, freeze. So to my mind, guessing that might make them more susceptible to developing a long-term condition such as PoTS or long COVID. Is there a link, or is that just me making up things?
There is definitely a link between traumas and how the body works, how the body functions, and how the immune system works as well. So people can get cancer after some traumatic episode in their lives. We have seen married couples when one in the couple loses the other one, and they were very close to each other. We have seen that the other person may get these other diseases that are, really terrible diseases, just like cancer. They develop it within 1, 2, 3 years after this episode. So traumatic episodes have a big impact on our body, on our immune system. Yes, of course. So there is no chance in it. There is no random effects. There is a very close link between the two.
And I guess globally, COVID itself is a traumatic experience, isn't it? There's a lot of people very fearful. So just that alone could be a contributing factor, I suppose, in that many people feel traumatized just for the fact that we're in a pandemic alone.
It's possible. Then we have a virus as well, which we can be infected with, and which may cause chaos in our immune system. Yeah. As a long-term consequence, we have seen an increase in PoTS cases just in the wake of pandemics. Yeah. There is no chance in it either.
Yeah. Okay. So perhaps going back and getting some help if you are one of these people who are struggling with trauma and PTSD, related, even just anxiety, getting help for that is something really sensible to do as well.
Absolutely. We used to say that PoTS patients, they need a multidisciplinary approach, and many different professionals involved in the care of PoTS patients, not only doctors, psychologists, and friends as well, families as well, physiotherapists, and so on. Yeah. And different organ specialists as well. You have problem with your heart, you have problem with your gastrointestinal system, with your nervous system. So this is a sort of family medicine on a higher level. with more specialists involved.
Yeah.
Say.
It's almost forcing a holistic approach, isn't it, to look at the whole body and everybody work together, which is, I guess, a good thing for medicine going forward, for sure. Okay, so other questions that we have from people. Why would blood pressure suddenly be elevated after 1 year with long COVID? Is there a link to dysautonomia PoTS in blood pressure raising? I know there is a specific type of PoTS, isn't there, where the blood pressure is high rather than low?
That's correct. Some patients have something what we call low blood pressure phenotype, meaning low blood pressure characteristics, meaning that the constitutional habitual blood pressure is very low. Other patients with PoTS may develop hypertension, and higher blood pressure, and we call it a sort of hyperadrenergic type, when the blood pressure increases, for instance, on standing. So instead of being unstable in a way that blood pressure goes down and back to the baseline, go down, back to the baseline, so fluctuate downwards and up, downwards and up. There is another type where the blood pressure goes up and down, go first up then down, and the average level is increased, it's higher compared with the baseline.
Okay.
So we used to call it hypersympathetic, hyperadrenergic type of PoTS. So there are two types how the body controls the blood pressure, and it means that the control is not sufficient enough to downregulate blood pressure, which is increased in the end. Okay.
All right. So definitely could be a relationship then with dysautonomia.
So before we start blood pressure increasing treatment in PoTS patients, I would strongly recommend that blood pressure profile has been analyzed through 24-hour ambulatory blood pressure monitoring. This is a very easy examination. You put a blood pressure device with a cuff on your arm, and then you bear it throughout the day and night, and then you can see the profile.
Yeah.
You can see the average blood pressure is low. Probably you will respond very nicely to blood pressure increasing drugs or medicines. Yeah. However, if the blood pressure is higher or very high, especially during the night, probably you should compensate it by adding blood pressure lowering drugs.
Yes. Okay, yeah.
This is a very important part of PoTS workup. And at our clinic, we perform blood pressure monitoring in a routine way.
Yes, and even increasing salt, as you kind of recommended last time for patients with low blood pressure, would be fairly dangerous if your blood pressure was consistently high, wouldn't it?
Yes, exactly. You touched a very important point. The treatment of PoTS patients should be tailored to the general overall profile plus cardiovascular profile as well. So you don't treat heart rate, which is maximally around 100 on standing with heart rate controlling drugs. You should start such drugs when heart rate is usually above 120. Mm-hmm. Then the effect of heart rate reducing drugs is much more effective than when treating relatively lower heart rate from the baseline.
Okay. A slightly related question, actually, and just curious, because obviously a lot of us have never really monitored our heart rates prior to being poorly with this. What is a normal, so for a normal person who's very healthy, what would a normal heart rate be when they sort of stand up and get dressed in the morning and brush their teeth? So a lot of our long COVID community are seeing heart rates jumping, 120, 140, even more, just from simple getting up in the morning and doing these activities. So what would a normal level be? What would you expect?
This is again a very important question. And I would say like that your average resting heart rate should be within the 60-80 range, or maybe 55-80 range when you rest. Then when you get up, the increase should be maximally by 10-15 beats per minute, or 10-15, maximal 10-15 or 20% of your baseline value. So this is the normal range.
Okay.
Then if you get up, if you stand up in the morning, it may happen that your heart rate increases just within 30 seconds, first 30 seconds, to compensate for the blood volume shift when you just raise yourself up.
Yeah.
And then after 30 seconds, after 45 seconds, maximum after 1 minute, it should stabilize. So if your heart rate is still increased after 1 minute and just keeps being very high after 3 minutes, 5 minutes, 10 minutes, then it's definitely not normal.
Okay, thank you. That's brilliant. Yeah, I wasn't sure what was the actual, what should we be aiming for. That's great, thank you. This is such an interesting one, and I think if we knew this, we would be well on our way to helping everybody. But why does long COVID happen only to some people and not to all COVID patients?
Probably gender issues, genetics. Some of us are more susceptible. If this has something to do with gender, probably 80–90% of long COVID patients are women. So the answer is quite clear. Now we have to deconstruct this difference, this genetic difference. Which points are the sweet points that we can attack or we can recognize as the real problem?
Yeah.
We know that women are in general more susceptible to autoimmune diseases.
Yes.
So if we copy this pattern from autoimmune diseases onto post-COVID, then we see the parallel, we see the analogy here. And one point which is very important to note here is that old PoTS patients, usually they had the onset when they were 15, 20, 25 years old, whereas post-COVID PoTS patients usually are in the range of 35, 40, 45.
Yes.
And predominantly women, 80% are women. So it must be genetics as well.
Yes, and I suspect because of the age group there that you've just said, it's 35 plus, I suspect as well that there's a hormonal element to this.
Yeah, you're right.
So
usually premenopausal.
Yeah.
Postmenopausal women don't get post-COVID so often. So
Yeah.
I would say that hormones or female hormones may play a very important role here.
I think so. And watch this space, because I've got another interview with a menopause doctor coming soon. So it'll be interesting to see her take on that as well. Okay, so do you think that by having had COVID, our immune systems are weakened now permanently?
I would not say weaken. It gets confused.
Yeah.
So the role of the immune system is to get rid of debris of what's unwanted in the body, what's dangerous and what's unwanted in the body. Then the immune system does not recognize your own cells as your own cells.
Yes.
Or your own elements.
Yes.
Good elements, necessary elements. And instead it recognizes this as something unwanted and starts to trying to get rid of it.
Yeah.
Which cannot end in a good way, of course, for your body. And then there are other mechanisms that may be in operation here, and we call them functional changes of your body elements. That antibodies, when they bind to different parts like receptors in your body, may change their function. They don't destroy your heart, they don't destroy your vessels, but they make them behave in a confused way, in an inappropriate way.
Okay.
So definitely, the immune system is not in order.
Yes,
out
but
of
not
order.
necessarily weak. Perhaps it's overactive rather than underactive.
It might be weak as well. If you try to deal with something unwanted with your whole body, then your focus, your energy is on this part of the problem, and you forget the other problems. Yeah. So this way, your immune system may be weakened by changing the focus from the right problems to problems that are not there, but they're created by the confusion.
Yes. Okay. Yep, makes sense. So I think, I mean, there's lots of very specific to one person questions that are perhaps better for people to raise with their own doctors, given, you know, it's down to their individual history. There's something about muscle weakness in legs. Is this autonomic dysfunction, or is this due to, you know, somebody was saying that they're being treated with steroids in hospital? Could it have been that, or the virus itself, or is it autonomic dysfunction that causes their legs to feel weak? And I know a lot of our group in particular say that they feel a lot of weakness in their muscles.
It looks like a more neurological problem, how the masses are controlled, and we call them neuromuscular problem, meaning that the nervous system, neural connections and muscles are built in a complex way. So masses are controlled by the nervous system. Yeah. So if the masses are weak, there might be some problem with the nervous system or with metabolism in the muscles. It might be as well some disease of the muscles. But if this is more localized to one part of the body, then it points out at the neurological problems more. However, there are some other problems with your legs that may be related to PoTS specifically, and it depends on the dysfunction of your venous system. We don't really know how what this depends on, but what we see in the end as a result of this problem is that there is a blood volume shift downwards in the body, and the blood doesn't come back to your heart in a proper way. And you have the excess of blood volume in your legs and in your belly as well. Yes.
And that's where the compression, we were talking about compression tights, help the blood to come back up. Yeah.
Exactly. That's why they work so well, because of this underlying problem.
Thank you. I think that is now half an hour, which is what we set aside, wasn't it? So I will finish by saying thank you so much again. You have been so incredibly generous with your time, and we appreciate you so much.
I appreciate this opportunity, Rhoda, and I would like to thank you because you are an advocate of all PoTS patients and that you want to share the knowledge with them as well. So I'm really thankful. I'm thankful for the sake of all who may listen to it. So thank you so much.
Take care.